running.
I know your name, I swear I do. It's on the tip of my tongue. Sorry, what did you say? And I've known you for how long? Your face is so familiar, but no name comes to mind. Please, can you remind me if you'll be so kind? Staring out into space, asking God to hear my case. Trying to think of all things past. How long will my memory last?
Well, hi, everyone, and welcome to Alzheimer Speaks Radio. I am your host and founder of Alzheimer Speaks, Lori LeBay, and we're going to have a really interesting conversation today. We're going to be talking about health advocacy, and we are lucky to have Tiffany Matthews with us, and I'll introduce her in just a bit. But because we always get new listeners, I always like to just tell people a little bit about Alzheimer Speaks. So bottom line, Alzheimer Speaks is an advocacy-based company providing multiple platforms to shift our dementia care culture from crisis to comfort around the world. We also help companies expand their brand footprint by leveraging their content or our content to increase access to products, services, and tools. And it's just a fun way to work together and to help raise the appearance of services out there that are so badly needed. I also want to thank our audience because you guys are so loyal and you share our content all over the place. And because of that, you have gotten us recognized by Oprah, Maria Shriver, and Dr. Oz. And I don't say that to pat myself on the back. I say that to say a deep, sincere thank you. You know, the more we can spread the word about Alzheimer's and dementia and caregiving and the needs that we have, the faster, we're going to improve services and support and hopefully find a cure for the disease. So thank you so much. I encourage you while you're listening just to, again, go ahead and hit that like button. Go ahead and tweet an episode out. Feel free to subscribe and just get these to pop up and come to you. All of our shows are accessible 24/7. So, and you can also join in the conversation today too by calling in at 323-870-4602. That's 232. No, it's not. It's 323-870-4302. I'm just seeing if you're on your toes. I'm not dyslexic. I also want to always like to shout out to a few companies that I think are doing some really cool work and have some resources that would be wonderful for you to tap in. One is called the Roberto app, and it measures your brain function by playing some video games. And it's a great way to just kind of check and see how you're doing on a day-to-day basis, or maybe you only want to do it once a week or once a month. It doesn't make any difference. Whatever is comfortable for you, but you may find that, your scores aren't as high when you don't sleep as well, or when you're not eating or exercising. You'll start to see some patterns come into play. Also, if there are some true consistent cognition issues, you're going to see that too and want to get into the doctor for further testing. I also want to give a shout out to the Women's Alzheimer's Movement. That is Maria Shriver's. I just adore her. She is going to be having a big event this June, several of them around the country and actually into Europe with Equinox fitness centers called Move for Mind. So look for more information on those. And then I always like to give a shout out to a company, Provalence, who is developing a new dementia resource directory, which is in beta testing right now. And you can access that on my website and learn more about it. Just go to alzheimerspeaks.com and then click on the resource tab, and I think you'll be fascinated with what is there. You'll be able to soon be able to share files and save files and geo searches to find lots of tools and services for you. So, with no further ado, let's talk about some health advocacy issues. I have with us today Tiffany Matthews, and she is the founder and CEO of Live Better Boomer, known as LBB. She is a healthcare advocate, and through Tiffany's products and services, her mission really is to educate and empower patients and families and care partners in terms of how to manage care in a competent and correct fashion in our current health system. Her grandmother really served as her inspiration, so we'll hear a little bit more about that from her. Welcome, Tiffany. How are you doing today?
I'm doing well, and thank you for having me. I really love your work and what you do.
Oh, well, thank you. I when I ran across you, I thought I got to have this woman on. This is such a needed issue. I see people, going to the doctors and a lot of times all by themselves and not having someone to advocate for them. And I know when we're sick, it's hard to take everything in, and that extra set of ears and eyes is so critical, especially when you're talking medical procedures or medications and things. So I'm really excited to talk to you today about your work. I always ask every guest of our show, just because our focus is primarily dementia and caregiving. Have you been personally touched by family or friends with any form of dementia?
Not, fortunately, not in my family, but unfortunately through my work and a lot of the patients in hospitals and, residents in nursing facilities where I worked. And, dementia is just, oh my goodness, it's such destruction to a family. It just comes along and, wipes everything away from them, even, realizing who their loved ones are. And I can't think of a disease more devastating than dementia. I've seen it in action, and it's horrible.
Mm-hmm. Yeah, it's not anything I would wish on anybody, but I do think that there can be still with any disease or chronic illness. I think there can still be beauty of the relationship, but it's teaching people how to get there and how to live in a relationship, because it's so easy to get so task oriented when medical care is needed, especially when we're not taught how to do that. But today, let's focus on health advocacy. Why don't you tell me a little bit, and our listeners, a little bit about why you started Live Better Boomers?
Well, my inspiration, as you said, comes from my grandmother. At the end of her life, she was in the hospital on a regular basis, and my family was helpless and powerless, as well as at a loss for what to do. So the business of healthcare will creep in. And when I say the business of healthcare, it's doctors pressuring families for quick decisions about, massive issues. For example, doctors, basically harassed my mom on a regular basis. Okay, what are you going to do? Are you going to put her on hospice or take off life support? Basically, in my experience, when facilities, whether it be clinics or hospitals or providers, when they see that they can't basically get any more money out of you, then it's time to do something. It's time to be discharged, or it's time to basically pull the plug. And my mom was thrust into caregiving, no preparation, no type of, advanced directives or planning. She just, went in head first. And it was really devastating for her, not only to watch her mom basically become a shell, and I hate to use that term, but a shell of who she used to be, as well as, having to deal with work and her own emotions and her own mentality. So the entire situation was devastating on our family, and there came a point where my mom needed help. And I felt so helpless in, trying to be there for them because I lived 300 miles away, and I had a job, and I couldn't just get away. So my mom called me and said, I'm going to jump out of the nearest window that I see. I said, why? She says, well, they're trying to send your grandmother home with a trach in her throat. She just had surgery. We need test results, all of these things. And the social worker is telling me she has to leave today. I said, Mom, please let me talk with the social worker, okay? Just go and get a cup of coffee. So the social worker calls me and she says, well, your grandmother's insurances won't pay anymore. I said, out of the 3, which one? Because I know most people have maybe just 1 or 2 insurances, but my grandmother had 3. So that was just basically bogus, for lack of a better term. So I told the social worker, listen, if you send her home unsafely, you'll be liable for whatever happens. And I will call the appropriate authorities in to go through your files to make sure that you treated my grandmother with the utmost respect and dignity. I said, now, if you'd like that, you can have her leave today. Hung up. We hung up because I was just done with her. But my mom called back and she said, what did you say to her? Did you threaten her? I said, no, Mom. I didn't threaten her. I just told her what she needs to do. And it got done. Their biggest fear as far as providers and staff in healthcare is someone that comes in and knows exactly what they're talking about and is willing to go forward with it. That's why I said to myself, how many other people don't know this information or have been harassed, for decisions or put out of the hospital before they were ready? People need to be empowered. Patients must have the education and the preparation to go into healthcare to manage it effectively. That's where Live Better Boomer was born.
I totally agree. Why do you think patient advocacy is important to the healthcare system itself? Because I think a lot of times people can view it as a threat or an uncomfortable situation, but how do you see it as really helping the healthcare system as a whole?
Well, it's kind of, let me put this analogy to it. If I was in my home and, let's say in my apartment building, you can only have 1 pet, okay? But if I have 3 pets, anytime someone knocks on my door, I'm going to be alarmed a little bit, and if they come in wanting to see how many pets I have, I'm going to be, I'm going to act like, well, that's not your business. You can't just walk in here. I'm going to have all kinds of things to say to keep them from finding out what's going on. Healthcare is the exact same way. It's the exact same way. There are things that people need to know that are happening, but they aren't privy to. And I've been that healthcare insider who sat in those meetings and said, okay, this lady has to leave. Well, she doesn't have any clothes. Put her out in blankets. I've been a party to that, and it made my skin crawl. Patient advocacy is vital in the system right now because there's no one looking out for patients. Even the nursing navigators and the managers and all these fancy terms you have for a patient advocate in the system, you have to follow the money. Their paycheck comes from a facility. or that healthcare system. So that's who their allegiance is to. I am a private advocate, so my allegiance is to the patient. There are not many of us out here. You know, many of us come from healthcare backgrounds and want patients to be empowered, but they don't in the system, because once you're empowered, your crap has to change.
Yeah, it's spooky stuff, and it always seems to happen. I mean, it always seems to be in that crisis mode too, where emotions are high, and you know, it's just extremely difficult to maneuver, and especially for people who don't appreciate and don't like conflict, it can just be absolutely horrible for them to think that they're going to stand up. And, you know, and they're like, well, what if they don't do it? Are they going to treat my loved one worse? You know, are they going to get mad?
Right.
Is there going to be repercussions?
Right.
And it's like, what a horrible reason to not step up. I mean, I understand it, but to be put in that position of trying to figure that out. I know I ran into a situation with my own father, who at the time had cancer, and he was doing really good, and we went home, and the next morning we came in, and he was like a whole different person. And as we were there for about an hour period, he just kept slipping. And I kept telling the nurse, something's wrong. And she's like, he's fine. And finally I just got in her face and I said, he needs an MRI. There's something going on internally with him. This is not my dad. I said, he's going to die. I can see it. He was slipping away. And he got to the point where he really couldn't even talk. He was having a hard time keeping his eyes open. It was just bizarre. And she refused to call the doctor. And I said, we need to get the doctor. And she's like, well, he's not available. I said, then get somebody else up here. And she wouldn't. So I went to the patient advocate in the hospital. And thank God I did. And, you know, within, I would say a half an hour, they had another doctor up there who looked at the chart and said, oh, my God, thank God you called, because the original doctor had somehow taken him off a critical medication, cold turkey. And he basically said his brain would have exploded because it was to keep the swelling down in his brain. And this doctor gave him a shot. And in 20 minutes, my dad was up watching the basketball game with my brothers and laughing and totally back to himself. But it was so uncomfortable to have to get that, because I was angry. I mean, I was angry. It was like, you're going down, lady, because someone in this hospital is going to listen to me, you know, or there's going to be hell to pay. But I don't like getting like that. But I had to.
Absolutely. And go ahead. I'm sorry.
Oh, I was just going to say I was so thankful that they had a patient advocate in the hospital. And my understanding is, and correct me if I'm wrong on this, but once there's a report, they have to act. They're not there to take the side one way or the other. They have to take action.
They absolutely do.
And I think a lot of times
they absolutely do.
Yeah. And I think a lot of times people think that, well, you know, they're just going to kind of give me the runaround, and that's not their role. Their role is to get to the bottom of it and get to it quickly, to avoid liability in the situation. And, you know, the last thing you want to do is end up in a situation where you are then suing because, you know, for mispractice or whatever it is, because that doesn't do you any good. You know, the damage is done at that point. So
the last thing that any health system wants to do is lose money. Profits are more important than patients, sadly. You know, and when I say all of these things, it's not as if I'm against providers. I'm not against healthcare systems. We need them. What I am encouraging is a partnership. Patients and caregivers have to step up to their role in the partnership in order to facilitate better outcomes for patients. You know, for example, you with your dad, had you not stood up, I would believe that you would shudder at what could have happened to him.
Oh, yeah.
You know?
Yeah.
And that's the thing. No person should be afraid of retribution when you see something that critical happening to your loved one. And retribution is against the law. It is against the law. You have to be able to understand that, go in with the mentality that you deserve the best care, and so do your loved ones, and make it so that that happens through partnership. However, like you did, there are some times where you have to get tough because people in the healthcare system, they believe that they know pretty much how all diseases manifest themselves in people, but people are different. And that's where the patients and caregivers come in. They're the expert on themselves and their situation. Doctors, nurses, they're the experts on medicine. There has to be a meeting of minds for optimal outcomes. But a lot of doctors really don't want to hear that. And as far as the healthcare system, my grandmother, she had absolutely the craziest sayings for everything. So she always told me, and I didn't get it until I got my own apartment, she said, Tiffany, if your house is always clean, you never have to worry about when company comes. If you're doing things in healthcare by the book and doing your best by each patient, you shouldn't have to worry about if someone has a complaint. You know what you're doing. You know, you've great practice, great, you know, patient relations. You shouldn't have to worry about it. But I've run into some egotistical doctors, and they're the ones that refuse to accept any patient input. And if patients have a doctor like that, it may be time to find a new one. You know, their health and their treatment is top priority, not anyone's feelings, not anyone's concerns or fear of retribution. I just want everyone to have the best care possible. Yeah.
Well, and I think that that's a good point too. That if you're not syncing with your doctor or the doctor's team, you know, that can be addressed. You have every right to go ahead and address that, and you know, look, you know, change. Look for another doctor. Look for another clinic, if that's the case. Because if you're not comfortable, you're not going to get great care because you're not going to probably be forthcoming in terms of what your needs are. So you have to be able to have that.
Go ahead.
Absolutely.
If you're not comfortable with the doctor because that doctor has spoken down to you or condescended to you or, you know, been aggressive with you, the relationship won't work. That partnership that you form with your provider will ultimately determine which way your health care will go and which way your actual health will go. For example, I had a doctor in the past. He knew absolutely everything. I could rattle off a couple of symptoms. Oh, it's this. Oh, it's that. And he was wrong on 2 occasions and medicated me for something that I didn't have. So it was time to leave him because he didn't care about my health. He seemed to care about his opinion being out there, and that was it. You know, that's dangerous.
And it's very frustrating. Very, very frustrating. And it's not a good relationship. I mean, you really need to have some type of respectful, you know, open relationship with your doctor and with your clinician.
Absolutely.
In order to get good care. And so as honest as we want them to be, we have to be too.
Right.
You know, in disclosing things that might be uncomfortable or, you know, maybe some things you don't even think they're related, but sometimes they are. And so it's good to let the medical professional hear those things. But it's a tough tough call. What types of services and products do you provide for people?
Well, I work with different audiences. I work with individuals, families, and caregivers. And for them, I have, coaching calls where you can get on the phone with me and we can go over your situation. And you have, personal access to me and my experience, as well as what I've put together is called the Powerful Patient Partner Program. And within that program, I've, set up 20 different modules of learning. And it can be about things like hospital stays, advanced directives, fall prevention, and how to advocate for yourself, to name a few, that show people, okay, these are the actionable steps I need to take. This is what I need to learn. I even have a behavioral component for people who don't believe that they deserve the best care, or that believe, like my grandmother did, that whatever the doctor says is the gospel. That's not true. They do know medicine, but it may not work for you. So I'm teaching people many, many different things in the Powerful Patient Partner Program to make sure that they can manage their care confidently and effectively while saving money, time, and stress. And I'm working on some digital products and a membership site so that people that may not be ready for the program come in and they can still get good information about advocacy and what to do and how to do and questions to ask. I want everybody to be equipped with what they need going forward in this disjointed, ineffective system and to come out a winner. I truly believe had someone gone with my grandmother to doctor's appointments, she may still be alive. She definitely would have lived longer. So I'm out here trying to change minds and save lives through advocacy. And as far as businesses and nonprofits and organizations, I have an a la carte list of services such as consulting or care planning or working with, individual employees to hammer out what their issues are that prevent them from working effectively. I put together different programs for businesses. I'm working on one with a home health care agency now so that within that system, patients have more power and more say. Education and preparation is key if you're going to advocate for yourself. You have to know what to do, how to do, when to do. And companies and nonprofits can save, while empowering people, can save a lot of money on their healthcare dollars. So I'm all for speaking with CEOs, HR managers, and my goal is just to make sure everyone is empowered and goes out there and uses their power so healthcare can change permanently for the better.
Good. I love your passion in terms of this, and I love that you kind of remind me of me in some ways because I was always told you have to kind of pick a lane, and you're kind of the same mode as I am. Everybody has to get on the same page and not be afraid of patient advocacy, no matter what end they're on, if they're giving it or if they're receiving it. They need to understand the power and the benefits to both sides. To have a respectful conversation and not just listen, but really hear what someone is asking for and what they feel the needs are. And I think that is really, really critical. And yet still isn't done, to the level it probably should be. We talked about people you're trying to help. Have you been able to, or maybe you haven't even thought about this, getting into even the medical schools to explain this angle? I just think it would be really cool for like the nursing staff and the doctors to have an idea of why this is so important to them.
I haven't really thought about medical schools. I have thought about nursing facilities. I have thought about hospital systems. But you're right. That needs to be a part of their thinking when they're ready to practice. You know, what's best for the patient? Is this decision I'm making patient-centered? You know, a lot of times people just go along with their job as a provider and don't really factor in patients like they should, or they have a horrible bedside manner, you know. And I'm, as a chronic patient myself, I'm speaking from experience. It is difficult to try and advocate for yourself at that point, but that determines a need for a proxy, or, and when I say proxy, a friend, a relative, you know, someone to come in and say, okay, she wouldn't have wanted that, you know, and she would communicate that to you if she could. I think it's of major, vital importance to have a proxy, someone to speak for you if you can't. And make sure that you keep your healthcare power even when you can't communicate it. I know I got off on a little tangent there, so I'm sorry. But, yes, medical schools, you know, this should be an integral part of their training, definitely. Yeah. And you've given me a new idea. So
yeah.
Thank you.
Well, I think sometimes we don't our school can be so academic and so task-oriented that we forget about the relationships and who we're actually serving and the dynamics of those and how to communicate within those. And that, to me, is really the key, you know, to good service and to good medical care. And not that you don't want, you know, a good doctor who knows the technical side, but man, they can alleviate so much stress in a family if they can communicate well, which then reduces, you know, some other significant kind of spin-off illnesses that can occur or symptoms that can occur that people are dealing with. Because stress, well, you know what stress does. It's just not a good thing.
Absolutely not. And I agree with you that communication is vital as well with providers. But providers have the duty of making that patient comfortable with them. If you're in a practice and you want customers, because basically that's what patients are, you have to provide the correct customer service. And then you'll have a thriving practice, you know, but they do get lost. And, you know, in defense of providers, they have a lot more work put on them since managed care reared its head, you know, paperwork and this and that and quotas. And we're not quotas. We're people, you know, and we need assistance if we're at the doctor. It's a lot of it comes from insurance and how it works, and that's a whole other phone call we could get into.
Yeah, well, I kind of like nowadays, and a lot of times when I go to the doctor's actually talking to me, and then there's the nurse or someone inputting the information into the file, so they're not multitasking. I have found that really very helpful, to be able to have their full attention while I'm there, and also just to have that extra set of ears and eyes, even though they're not in on your side and taking notes specifically for you. You could probably ask the doctor for those notes that they inputted. I would imagine that they could print those out. And
well, I've had that too. And when I've taken notes at the doctor, he said, "Oh, no need to take notes. We'll put it all on here for you." You know, that is convenient. That way I can pay attention to me, and the doctor can pay attention to me, and I can pay attention to them as well. You know, everybody's attention is in the right place. And even, you know, patients that don't have access to a doctor like that and don't have anyone to go with them, everyone's got a cell phone these days. Record it. Record it and or document everything that's happening and gone on, because it may end up being something that you have to refer to in the future.
Yep.
So I encourage documentation for everyone in becoming an active and strong patient, a powerful patient.
Yep. Well, that's good. Now, do you do any speaking or training publicly to people, or do you do contract only to specific businesses?
Oh, no, I'm willing to, come to any organization or business or nonprofit and do a workshop in the beginning, and speak with them about maybe further services. But I just want everyone to know that this is possible and it's out there, and there are people to help you, get through healthcare, whether it's a new diagnosis or you have a chronic condition, or, you were thrust into caregiving. Yesterday you weren't a caregiver and today you are. That could be alarming for a lot of people. But going out, I speak to senior centers. I've spoken to churches. I have absolutely no problem doing that for anyone, anywhere, whether it's live or virtual. Yeah. But with businesses, I do contract work as well, where I will do speaking there too. So I just want people to be educated and informed. Okay.
And then as far as, do you do like one-on-one coaching and then group coaching as well, or how does that work?
Well, group coaching is a little bit down the road. I'm going to be really planning that out in 2019. But as far as one-on-one coaching right now, I'm offering care planning, where someone could be in a situation and not know which way to turn. I could speak with them, map out a plan of care for them that they can do themselves or I can do for them. And, again, I have my coaching calls where, patients or caregivers or veterans or parents of disabled children can book a time with me for a fee, and we'll go over what's happening and basically kind of do the same thing but without a map. But everyone, will have access to me and, my experience, and, we can figure out what's going on and where they need to go.
Okay. Let's see. I wanted to know if you can let the listeners know where you're located, and if you just serve local, or if you'll go national in terms of coaching and things.
Well, right now I'm in the Philadelphia area, and mainly I'm trying to do, work with companies and do FaceTime there. But I have no problem speaking with anyone nationally, because people don't just need help in Philadelphia. They need it everywhere. So if I can be of service to someone and help them with their situation, or put together a program for employees that are missing work or stressed out or not focused, and if that's in Boise, Idaho, fine, no problem. I have the availability to, do that for anyone, whether it's virtually or in person.
Okay, great. Is there any other information that you'd like to share with our audience that we haven't covered?
Oh, we don't have like 3 more hours, because I'd love to get into it. But, I just want people to really understand that they deserve the best care possible, between insurance premiums, co-pays, co-insurance, and deductibles. Don't you think you deserve that? And make sure that your health care is your number one priority. If you're no good to yourself, this includes caregivers, definitely. If you're no good to yourself, you're going to be no good for anyone else. You have to be good to yourself first. you know.
Yeah, that's
and
very true.
Go ahead.
No, I was
Absolutely.
just saying that's
Absolutely.
very true. And a lot of times we don't think about that stuff. You know, we don't think
Right.
about, we're too busy caring for everyone else. There's not enough time for us, and that's a big piece. So
Absolutely. Absolutely. And just to know that it is possible to get better care, but you have to be educated and prepared for it. And I'm more than willing to help, you know, people that need help in a crisis situation or that just want to know what to do and when and how. You know, I want to just get people ready for the battle that is healthcare right now. It's horrendous. And I'll use this last analogy. If you went to a restaurant and you ordered a steak and you got a pork chop, wouldn't you say something about that?
Yeah, for sure.
People need to use that same attitude with their health care, because your health care is more important than a steak.
Yeah, that's
Absolutely.
for sure. Yeah, you can
Absolutely.
get another steak, but you can't always get your health back, you know, once
Exactly.
it's taken a turn on you. So, yeah, very, very important. Well,
Absolutely.
Tiffany, this has been an interesting conversation, and why don't we tell people how they can reach you? I believe your website, and correct me if I'm wrong, is lbbhealthcareadvocacy.com. That's lbbhealthcareadvocacy.com. You're also on Facebook, and I believe your group there is the Caregiver and Patient Protection Project. So if they just put that in the search bar, Caregiver and Patient Protection Project, you'll be able to get to Tiffany on Facebook. And then did you want to give out a phone number?
Sure, absolutely. My telephone number is 215-260-7782. Again, 215-260-7782. And I'm happy to talk with you and let you know how I can help you. And I'm ready to serve people that really need the help and want to make a better effort for their care. And, you know, basically find out what they need to do to help themselves have the best care possible.
Yeah. Well, and
so,
sometimes it's
reach
just
me.
Nice to have somebody who understands what you're going through. Because even I know sometimes with family, you can talk to people and they're out of the loop and they don't get the urgency or the crisis that you're feeling is impending because you're the primary, care partner, or they're not seeing all of the symptoms and things that are happening, or they weren't at the doctor's office to see the interactions, whatever it is. They're a little bit removed,
right.
and that can make a big difference. Not that anybody can fix your life, but they can support you through it and guide you through it to make it a little bit easier. And
right,
and that,
absolutely.
And that just makes such a huge, huge difference there. Well, thank you so much for joining us. And again, you can get a hold of Tiffany Matthews through her website. That's lbbhealthcareadvocacy.com, or you can call her at 215-260-7782, or check her out on Facebook. Just in the search bar, put in Caregiver and Patient Protection Project, and she will get back to you. Thank you for your
Absolutely.
work. Appreciate you sharing it with us. In wrapping up today, I am just going to announce that if you are in Colorado, I am going to be out there early June. I'll be posting some information on my website today on the home page. I'm kind of doing a tour of various places. But again, I want to say it's June 4th to the 11th, 10th or 11th. I'm going to be out there doing quite a few different presentations. And then I also wanted to give a shout out to the American Senior Magazine. They are a lifestyle magazine for seniors with topics ranging from nostalgia and health and wellness to interviews, and they also spotlight notable older Americans. And I love it because they got big print, and I don't even have to put my glasses on to read it. And it's just a nice kind of fun magazine to receive. I believe it comes out quarterly. And if you go to alzheimerspeaks.com on our homepage, I think you'll see an ad there that you can go ahead and get a discount on. And then I also want to remind people if they're looking for a memory cafe, you can go to memorycafedirectory.com. That's memorycafedirectory.com. And the last one I'm going to shout out to is the Alzheimer's Research and Prevention Foundation. If you're looking for a holistic approach, diet, exercise, meditation, please check them out. Just go to alzheimersprevention.org. With that, have a blessed day, and we'll talk soon. Bye now, everyone.
Hi, this is Suzanne Newman, host of the Answers for Elders podcast and radio show. We are the North Star that guides you through the complicated journey of senior care with trusted experts in money, law, living solutions, and more. So join us on this station, your favorite podcast channel, or just go to answersforelders.com. Meet the Wayshowers who will help your journey go a lot easier.